My name is Amal Nirgudkar. I'm the CEO of Patient Prism, and we have JoAn Majors in our studio this morning, and she is a professional speaker, author of multiple books in dentistry. She has taught hundreds and hundreds of practices and given speeches all over the country on how to make dental teams perform better. My question close to my heart is about the handoff that happens on the phone. The receptionist answers the phone, books that appointment, gathers a lot of incredible information on that phone, right, and then hands it off. How do we make sure that everything, that handoff is optimal?
Sure it is. And thanks for having me. I think, Amal, one of the things that we often overlook is it's great to have all that data that we gather, and obviously we know that you guys are stellar at helping the office team understand how valuable that phone call is.
Absolutely.
The questions to ask and that sort of thing, but what happens with that data? For me, it's like, I always think about people who, you'll see somebody that lost weight and they say, oh, wow, you look great. How'd you lose weight? And then they're already into their next sentence. They didn't ask because they really want to know.
Right.
They ask because they just needed something to say.
Right.
And I think about why this is so important that we ask those questions, but we're not asking just to gather the data. Sure. We're asking to transfer it. So transfer of power. You think about a beautiful marathon race where you can see that baton go and you know that that next person has it securely. The tee-up, they call it handoff, whatever you want to call it. But for me, to find out, like, for instance, how they like their information, or is somebody that wants a lot of information or not much information? What did they like about their last practice, not like? What's really important to them to happen at this appointment for it to be a value of their time and money? All the questions, the great questions that we gather are not worth anything if we don't get that to that morning huddle.
Right.
So you and I know, we both hear a lot of people that say, well, we don't have time for a huddle, or we split shift or whatever.
Sure.
I've spoken to a lot of groups, and there are a lot of people who have that issue, especially in some of the bigger group practices like we like to work with, but there's still a way to send that data to make sure others get it. Okay. Because it's not worth asking the question if you can't ensure to the patient when the patient comes in that you got that. I mean, that's one of the first things that we do is we're taking them back to say, Amal, I know you spoke with JoAn on the phone yesterday, and she shared with me about this experience of having to wait 45 minutes for the doctor to enter the room, and I want you to know that we've all taken note of that, and that's why you have the 2 o'clock appointment today, because we know that you don't appreciate waiting. It's taking the information and having the patient know that we actually heard
and
it.
really converting that data into intelligence. We talk about it a lot,
That's
right?
exactly what it is.
Because again, it's not
a
filler word that you're saying to keep the patient engaged. It's information, because every time we talk in personal conversations, if you remember in interviews, we tell people all the time, make sure you remember what the interviewer asked you at the beginning of the interview, middle of the interview, and ask those questions back again, because when you reaffirm what was important to you, you're going to be like, man, that person was listening.
That's exactly
and they care about me.
That's exactly
and
right.
it instantly builds that rapport.
Right. I think, too, with the way that the changing face of authority and the way that trust has changed so much, these are the things that are really critical. You can no longer, because you're board certified specialist of any type, or because you've trained at all these places, you used to, you could market that and it mattered.
Right.
What we know today is that if you're not listening to me, then you have to earn my trust, where when I was growing up, I mean, if they had those plaques on the wall, we trusted them, right? And now we know it's different. So asking the questions and then taking that data and transferring it as they go through the entire practice is what I believe that has patients say yes to the treatment.
And that handoff is important at every aspect, right? Not just from phone to the back, but from hygiene to the doctor.
Absolutely.
From doctor to the treatment coordinator.
Yes.
From treatment coordinator to the
back to the front office.
Back to the check. So every single one of these handoffs, you have to exchange information that you've learned from the patient.
Sure.
That instills in the patient that you value them and you've listened and understood and appreciated their concerns.
Yeah, and we use a term called overhear psychology. We will, if you were the doctor and I were the assistant or hygienist and we had a patient here, we would be sharing information that we knew absolutely, maybe you'd already discussed or I'd already discussed with the patient, but we're sharing it to have them hear again that we have heard them. And for me, it's like we shouldn't be asking unless we're asking to actually learn. And we've all been to a physician where they said, what are you here for when you make the appointment? Then you get there and they say, fill out your paperwork. What are you here for? And then you go back and they take your blood pressure. What are you here for? I'm going to weigh you and do this. What are you here for? What are your medications? I mean, then the doctor comes in and says, how you doing? What are you here for? And you go like, people talk. I mean,
That's
really.
right. I mean, Simon Sinek says all the time,
Yes.
right? I mean, we often here to respond and not here to listen, right? And it's so important to do that. So
That's exactly
great
right.
segment on transfer of power and handoff. Thank you so much.
Thank you.